Well, it is sadly a problem that we see not only across our state, but across the country as well. And of course, we're talking about opioid overdoses. And while we are seeing a decline in the number of deaths from these overdoses, opioids are still involved in nearly 70% of all fatal overdoses. And that is why communities around the country, including here, have begun to install harm reduction vending machines. Joining me now to explain more is Morgan Jared, the director of the ER at HCA HealthONE Swedish. Thank you so much for being here today.
It's a pleasure being in your presence, sir.
This is such a unique idea. Vending machines, of course, have been around forever, but we're starting to see more and more things, and this is just the latest. Walk me through how these work.
It is, yeah. So the idea is bringing the care to the community, right? One of the biggest things with healthcare and the barrier to it is friction in the system. So when we think about systems, we want to say, okay, how do we reduce that friction? How do we get that care to the community? You know, at HCA HealthONE, we're committed to the improvement of human life, and a big part of that is preventative medicine and proactive approaches to things like opioid overdoses. So you've got a vending machine, they can be anywhere, so it's not geographically limited. It doesn't have to be a Walgreens, CVS, a hospital. You can put them literally anywhere. So, you know, high density areas, high traffic areas, and you can put a variety of things. You know, I know naloxone, which is Narcan, is one of the primary things that we're talking about today, but there's also fentanyl test strips. There's other first aid items. It's a pretty robust program when it's been rolled out in other states, and definitely something that I am encouraged to see as a healthcare professional, because again, the faster we reduce friction, the more available that we make these things, the better outcomes people have.
Yeah, absolutely. When we talk about naloxone or Narcan, a lot of confusion, I think, from people about what exactly this is and what this does. Could you describe that quickly?
Yeah, absolutely. So whenever you take an opioid, it interacts with something that's called the mu receptor, and that creates sedating properties. And if you take too much of it, it can make it so you stop breathing, and that respiratory effort is what we're really trying to address. When you give Narcan to somebody, it intercepts that opioid and makes it so that those receptors are more available, or they're freed up, and so you begin to breathe. So the effects are really, really rapid, and it is fairly easy to administer, and so it's a great public health item and a great service to the community to have this readily available.
We've seen some critics of the machines worrying they could end up kind of enabling people and not helping. Do you agree with that or not?
You know, there's a reality to the dynamic where when people have these things, it does perpetuate some behavior. However, at the end of the day, there's somebody in front of you who needs care. And this is a way to get that care to them so that they can continue to seek help, look for resources. We have a lot of community resources for people who struggle with addiction. Getting them to those resources is how we win as a community and as a society. And so if this makes that easier, then I'm all for it.
You talked about seeing somebody in front of you in that life or death situation. I'm curious, working in the ED, is this something that you see on a regular basis?
Fairly regularly. I think that we spoke about it in the headline, is that opioids are a huge piece of the equation when it comes to overdoses and ingestions. And we treat this very regularly on a weekly basis.
Yeah, wow, makes sense. These vending machines, do you have any on your campus, or are these just kind of spread out throughout the community?
Yeah, I think it's probably a fairly new idea to the Denver metro area and new to the market. We don't have any on our campus, but in our ER, we give naloxone or Narcan to anybody who needs it or who comes in for that complaint. We're actually one of the first ERs that started that program in the Denver metro area, so a point of pride for us.
Yeah, big deal.
And we will continue to do so.
And then real quickly, if somebody needs help, you know, beyond the vending machines, I guess quickly resources for them are always available.
Yeah, 911 is the best way to get there. Our Denver Health partners, our South Metro, West Metro partners do a great job serving the community. They're a huge asset to us, and so they're just a phone call away.
Perfect. Jared, thank you so much for joining us today. Thanks for all the great work you do in the ED, keeping folks alive and spreading this message. We appreciate it.
We appreciate you. Thank you.
Absolutely.